Lost Kings, you're deciding between PA school and medical school. Any advice? I think the biggest things when you're kind of figuring out like whether or not you want to go into medicine as a PA or a medical student or a doctor, one of the biggest things that I kind of looked at was the responsibility factor, the lifestyle factor. There's so many different things that you can, I guess, consider when you're making this decision. I knew I wanted to go into medicine, become a doctor, because I wanted to be someone that made the final call. I wanted the responsibilities of a physician. I wanted somebody to be somebody that could guide and control, I guess, the patient's course of action and their treatment plans. Not to say you can't do that with other fields. The difference is you just have the final say when you're a doctor. When you're a PA, you're a lot of the times playing in a secondary role if you're working under a physician. There's a lot of PAs though that do work independently and can prescribe on their own, do work independently, and that's something that's kind of evolving over time now. So I think that it's important to research the position, research and understand what you want as an individual, and then go from there. I think that that's the best course that you can take. Again, for me, it was the responsibility of a physician and knowing that I was the one that was kind of always going to be in control of my patients and their outcomes. But you know, what things do you have in mind as far as like what are your goals and some things that you're kind of debating over between PA and MD? Not really sure. So as a physician, my goal would be orthopedics. The only thing I like about PAs is quicker money, if that makes sense. Yeah, so I think that it's tough because when you're a PA, yeah, you can get there faster, but you could get there faster for the reason that you're kind of limited in your abilities. As a doctor, you know, you could do a lot more. You have a lot more freedoms, less limitations. And with a PA, yes, you could get there faster, but you know, why can you get there faster? Because the training is less, and you have to do less training because you have less responsibilities. And I think that it depends on what you want. So if you don't mind having that cap on you, you don't mind having a potentially a supervising physician that you're working with and collaborating with all the time, if you don't mind not, you know, being the ultimate say and making the final call all the time, and you like that lifestyle, you like that role, and you enjoy making, you know, the six-figure salaries that PAs make, then PA might be the route for you. But it's tough too when you're first starting off and you think you want to do something, and like you said, you wanted to do orthopedics potentially, and you know, with that, it's like, I had the fear too. Will I like everything else in medicine? Will I enjoy medicine as a whole? Or do I kind of just like this one aspect of medicine? So I think it's taking a step back and looking at what do you truly want out of your, you know, ultimate life and career goals. If you took away all the other factors like, you know, the amount of schooling and all those other things, what do you envision for yourself? What's going on, everyone? Thank you so much for clicking on this video and for watching. If you're new and this is the first time you're watching one of my videos, my name is Terence and I'm currently a first-year medical student in Philadelphia. If you're new, make sure you subscribe, like the video, and share with somebody that may need it. My goal is always to grow the channel and help others that may need it. So if you know somebody that may need this type of video, be sure to share it. If you're interested in hopping in on one of my live streams, make sure you subscribe and turn on post notifications so you know when I go live. Thank you again for watching. Be sure to subscribe and let's get it.